Hi, the topic is syphilis. Syphilis is a sexually transmitted infection. Syphilis has different stages: primary syphilis, secondary syphilis, tertiary syphilis. In some people, syphilis can spread to the brain, ear, or eyes. Some people have no symptoms, which is usually called latent syphilis. Primary syphilis is the first stage of infection. Symptoms may start 2 to 3 weeks after the person becomes infected. They usually get a raised bump, red spot, where the infection first entered the body, usually painless. It then turns into a small sore or ulcer. It has a raised edge, usually formed on the penis or around the vagina or anus. It could also be in the back of the throat or inside the vagina or rectum. Usually they heal by themselves within a few weeks, and because they don't hurt, many people don't even see them or seek treatment. After the first sores heal, some people develop secondary syphilis. Secondary syphilis usually starts weeks or a few months after primary syphilis. It happens in 1 out of 4 people who don't get treated for primary syphilis. The symptoms will include a widespread rash, large raised gray or white patches on warm and moist areas of the body, like the mouth and the genital region, fever, headache, sore throat, muscle aches, and other flu-like symptoms, swollen lymph nodes in the neck, armpit or groin area. People with tertiary syphilis usually develop symptoms years after getting infected. It happens to a small group of people that didn't get treated before. People with tertiary syphilis can have damage to the heart, skin, brain, and other organs. Latent syphilis is a period of time where syphilis is not causing any symptoms. It's divided into early latent syphilis. This is when the person gets infected within the last year. And then late latent syphilis. This is when the person has been infected more than 1 year. Sometimes the person might not even know when they got infected. Neurosyphilis. This is when the infection has moved to the brain, the spinal cord, or other tissues. Neurosyphilis can happen during any stage of syphilis. Symptoms may include headache, confusion, nausea, vomiting, a stiff neck. If the doctor suspects neurosyphilis, the person may need a lumbar puncture or a spinal tap. Ocular syphilis is when the infection affects the eyes. Otosyphilis is when the infection affects the ears. These can cause vision or hearing problems. It can happen to anyone, but it is more common in people with HIV infection. There are blood tests to help diagnose syphilis. Syphilis is usually treated with bacillin or a penicillin. The length of treatment depends on how long the person has had the infection. Some people may need to get 1 injection, 3 injections, or IV or intravenous treatment. If the person is allergic to penicillin, there are some other options available. The person should let their partners know that they have a diagnosis of syphilis. The partners should get tested. Some of them will need to be treated, even if they have no symptoms. After completing the treatment, the person needs to be tested again to make sure the infection is gone, is cured. Some people may need repeated testing throughout the year to reduce the chances of getting syphilis or other sexually transmitted infections. The person should use condoms consistently. Avoid sexual activity when the person has symptoms. Do not share sex toys. Do not have sex. There is doxy-PEP or PEP or post-exposure prophylaxis that is indicated mainly in men who have sex with men and transgender women. If the person is pregnant, it is very important to get tested and treated. Syphilis during pregnancy can cause problems if it is not treated, especially to the baby. It increases the chances of pregnancy loss, miscarriage, stillbirth, and the infection can also be passed to the baby, which can cause serious health problems for the baby. I hope this topic was helpful. Thank you.